On this Thursday night, the impending crisis of dangerous variants. How Ontario dreads a tsunami of cases is coming in just weeks as Pfizer's vaccine deliveries diminish.
They've let the people of Canada down.
Triggering concerns the federal government can't deliver on its promises. Protecting Indigenous Canadians, the mission to restore trust in the healthcare system. A poisonous environment, being humiliated and screamed at. The scathing independent review into the former Governor General's workplace. And the battle between hedge funds and amateur investors. The story behind the frenzy of GameStop stock.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with the slow pace of Canada's vaccine rollout and a new warning. The rise of more transmissible variants of COVID-19 could usher in new waves of contagion. In Ontario, a top COVID-19 advisor says there is now clear evidence the UK variant is circulating in the community and it's described as a significant threat.
The new variants of concern, the mutated SARS-CoV-2 virus, are clearly spreading in the community and will likely be the dominant version of the virus in March.
Around the world, governments are racing to roll out vaccines before these new variants take hold. In Canada, it is slow going. The federal government has repeatedly said every Canadian who wants a vaccine will get one by September, but we're not on target for that right now. Here is Canada's vaccination track record. The number of doses administered was rising in early to mid-January. It has now plunged, in large part because promised shipments of the Pfizer-BioNTech doses to Canada have stopped. The company says it's retooling its plant in Europe so it can scale up production. Major General Danny Fortin, who is leading the rollout in Canada, calls the delay a bump in the road.
Pfizer has assured us that Canada will receive 4 million doses that they had previously indicated by end March. So they assured us of that, and we're working to that end with Pfizer.
That promise, though, contradicts what the provinces have been told. They have been asked to plan for 3.5 million Pfizer-BioNTech doses by the end of March. And complicating all this is a push by Pfizer to stretch the number of doses in each vial from 5 to 6. But that requires a special syringe most vaccination sites don't have. Eric Sorensen has our top story tonight.
The government's point person on vaccine distribution couldn't be more clear.
Pfizer has assured us that Canada will receive 4 million doses by end of March. Full stop.
Except the government is straining to explain whether Pfizer will actually deliver 4 million vaccine doses. Ottawa's plan earlier this month showed a steady rise to more than 300,000 Pfizer doses to be delivered each week, to a total of almost 4 million by the end of March. But a new planning document sent to the provinces highlights the recently announced cuts in Pfizer deliveries, down to 0 this week, and much lower numbers till mid-February, to a total now of just over 3.5 million at the end of March, 500,000 fewer than before. Several premiers are unhappy.
Pfizer has let us down tremendously. It's, again, unacceptable. You know, they have an obligation to meet the contract.
Adding confusion, Pfizer wants to change the count for each vial of vaccine to 6 doses from 5, which could help make up for any shortfall. But it's something Health Canada hasn't approved yet.
What is the plan? The Prime Minister said he had a plan.
The opposition is perplexed, suggesting the government is failing to deliver what it planned. But the Deputy Prime Minister insisted Pfizer's commitment, plus the doses from Moderna, will arrive by the end of March.
6 million will arrive by the end of the first quarter, and every Canadian who wants to be vaccinated will be by September.
The problem, this country can only administer what it receives, and that number for now is modest. Canada has distributed vaccines largely in line with the population of each province, in all distributing 1.1 million vaccine doses across the country. The total administered so far, more than 900,000. That's 81%. Most are just first doses. Doctors are concerned about any cutbacks this winter because the most vulnerable need vaccines sooner, not later.
The fact that this is phase 1, it's the most vulnerable phase. It's the one that will stop hospitalizations. It'll stop mortalities. We need to get this vaccine into our country and into people's arms as fast as possible.
Ottawa insists the outlook remains promising because vaccine deliveries will ramp up to more than 20 million doses between April and June. But until then, the numbers will be low and the anxiety will be high. Eric Sorensen, Global News, Toronto.
Here's another story about numbers. Ontario has issued a major correction to its vaccination database. The province says it inadvertently double counted the number of completed 2-dose vaccinations. The province had been reporting just over 96,000 people had received 2 doses. In fact, that number reflects the total number of doses administered. Just 55,000 people in Ontario have been fully vaccinated with 2 shots. An Ontario nurse has tested positive for COVID-19 nearly 2 weeks after getting the 2nd dose of the Pfizer-BioNTech vaccine. Santos Barral says he doesn't have any symptoms and was speechless when he got the results.
When my manager called me that I got tested positive, I couldn't speak for a while. How it happens, I didn't feel nothing so far.
Barral is isolating at home away from his family. Experts say there are several possibilities to explain his case. Clinical trials showed the Pfizer-BioNTech vaccine is 95% effective, so he may be among the 5% it doesn't work on. It takes a week to 10 days after being vaccinated to become fully immune, and he may have been exposed to the virus before the vaccine took full effect. Despite his situation, Barral is encouraging everyone to get vaccinated and to follow all public health guidelines. Despite a scarcity of vaccines right now, the federal government is sticking to its plan to vaccinate people on remote First Nations and Métis and Inuit communities by this spring. There are more than 3,500 active cases of COVID-19 on First Nation reserves. 144 people in those communities have died. About 37,000 people in 196 Indigenous communities have received the first dose of the vaccine. Shortages and logistics are 2 big challenges, but so is a long history of racism and mistreatment that's left a legacy of mistrust in Canada's healthcare system. Michael Couteur reports, and a warning: some of the images in his story may be disturbing.
If the real coronavirus enters our body later...
As the COVID-19 vaccine rolls out to Indigenous communities, so too is an information campaign, including pictures of chiefs and community leaders getting their shots. Some of it may seem hokey, but it's to counter a history.
Vaccine confidence is something that has to be earned in Inuit communities.
Naten Obed represents Canada's 60,000 Inuit, while communities like Nunatsiavut in Labrador say 71% of the adult population has been given the first dose of the Moderna vaccine. There remains distrust.
Considering the experimentation on Inuit, First Nations and Métis children in residential schools, especially on nutrition supplements and other health research projects.
Working against legitimate fear of the healthcare system in terms of vaccines and deployment of the vaccines in a culturally safe fashion.
Those experiences have been passed down through the generations, and there's been a more recent example. Video of Joyce Echaquan being insulted and degraded by hospital staff in Quebec exposed the systemic racism Indigenous people face in the healthcare system. It prompted a 2-day meeting between governments and stakeholders, resulting in a path towards distinctions-based Indigenous health legislation.
The issue of self-determination over healthcare is key foremost as a matter of right, but also as a matter of positive medical outcomes.
Outcomes like a safe and effective vaccine rollout to all Indigenous people, even those living off reserve in urban settings. The National Association of Friendship Centres has offered to set up vaccination clinics to reach those people, but there have been issues.
The day before the clinic was supposed to happen, the hospital that was providing them with the vaccine said, the province won't let us give you some of our vaccines.
That clinic alone would have immunized 60 high-risk Indigenous people in Toronto. Instead, it had to be cancelled, and those individuals are supposed to be the top priority for vaccination, according to both the province and the country. Michael Couteur, Global News, Ottawa.
With vaccines in short supply, it's imperative no dose goes to waste. So when some healthcare workers in Oregon got stuck in a snowstorm, they came up with a plan. They were driving back from a vaccination clinic when heavy snow stopped traffic. Knowing their vaccine supply would expire within a couple of hours, they set up an impromptu clinic, going from car to car and offering the 6 remaining vaccines they had to stranded motorists. The independent review that led to the downfall of Julie Payette, Canada's former Governor-General, has now been made public. Payette, a former astronaut, resigned last week, and the report makes clear why. Dozens of employees described the work environment at Rideau Hall as hostile, toxic, and poisoned. Much of the report is blacked out, but there's enough information, which came from multiple former and current employees, to paint a damning picture. Our chief political correspondent, David Akin, has been looking through the report. David?
The report was prepared by an independent firm, Quintet Consulting, which was hired by the Privy Council Office, or PCO, in late August to investigate media reports of a troubled workplace at Rideau Hall. Thanks to access to information laws, we now have the heavily redacted report. And it documents a workplace where yelling, screaming, aggressive conduct, demeaning comments, and public humiliation were common. Quintet said it was overwhelmed by the number of Rideau Hall employees who wanted to provide information. Of the 150 or so employees, 92 volunteered to be interviewed between October 19th and November 23rd. Quintet, in fact, had so much material employees wanted to give it that it had to limit the interview times. Most of those interviewed had worked for more than one governor general, like David Johnston or Mikhail Jean. Of the 92 interviewed, only 10 had positive or neutral assessments of the workplace under Julie Payette, and most were speaking out for the first time.
Current employees and past employees had a significant fear around reprisal. So they were concerned that if they came forward and complained about the public humiliation, the toxic work environment, they might lose their jobs.
And while Payette had said she welcomed the independent review, a close reading of censored sections of the Quintet report suggests that Payette or her hand-picked top aide did not cooperate with Quintet's investigation.
There wasn't really an acknowledgement from the management side or the mothership level that toxicity was an issue in the workplace. And as an employment lawyer, I can tell you that's extremely troubling.
And the next human resources headache for the Trudeau government might be right around the corner. An investigation into workplace harassment at the Canadian Museum of History in Gatineau, Quebec, has just been finished, and that report was turned over to the government this morning. Donna?
Okay, David Akin in Ottawa, thanks. The reality of immunity inequality. Coming up, the agonizing wait for vaccines in some of the world's poorest nations. While Canada and other first world nations complain of a scarce vaccine supply, many other countries around the world have yet to receive any doses. The world's poorest countries have been left waiting for help from the wealthiest countries. Crystal Goomansingh explains.
With a coronavirus variant of concern ripping through the South African population, protection from the virus is critical. Yet there are only a handful of vaccination campaigns underway on the African continent.
Mauritius started vaccination since 2 days ago using the AstraZeneca vaccine. And the data that we have received this morning is showing that close to 450 people have already been immunized. Morocco received 1.5 million doses last week and is going to start vaccination tomorrow.
Seychelles is the most advanced. Roughly 25,000 people have been vaccinated using 2 different vaccines, including some shots from AstraZeneca donated by India. Many African countries and low-income nations elsewhere in the world are waiting for discounted or donated vaccines from the World Health Organization and its COVAX partnership. Canada has pledged to hand over its excess doses and has committed $440 million in support.
I think the first doses available to the COVAX facilities will start in February this year. And then in March and April, there's going to be a rapid scale up, of doses.
Dr. Robin Nandy says the hope is for 30% of healthcare workers and high-risk people across Africa to be vaccinated by the end of 2021. A stark contrast to vaccine goals in Europe and North America. Randall Hansen sees a potential silver lining in the inequality.
And the quicker that they're up and running, the quicker it will be that we actually have the wealth to vaccinate the global south.
As countries wait for a vaccine, groundwork is being done, so healthcare workers will be ready to get shots in arms as fast as possible. Crystal Goomansingh, Global News, London.
This is Lebanon's lockdown still ahead, the rage of a nation in crisis.
Еще раз хочу сказать, у вас не получится запугать нас.
That is Russian opposition leader Alexei Navalny denouncing a court ruling that rejected an appeal of his arrest. Navalny told the court, "You won't succeed in scaring tens of millions of people who have been robbed by the government." He was taken into custody January 17th when he returned from Germany, where he spent 5 months recovering from nerve agent poisoning he blames on the Kremlin. Navalny's supporters are organizing another round of mass protests across Russia on Sunday. Police have been rounding up his associates. This doctor played the piano while her apartment was raided today. Navalny's wife and brother have also been detained. People took to the streets in Poland tonight. They're angry about a court ruling which effectively bans abortion. In October, Poland's highest court ruled terminating a pregnancy because of a fetal defect is unconstitutional. Abortion will now only be permitted in cases of rape or incest, or when the mother's health or life is in danger. The French European Affairs Minister tweeted today, "It is a reminder rights can recede if they are not defended." And in Lebanon, security forces fired tear gas at protesters angry about strict lockdown measures and poor living conditions. This is the 4th straight day of violence. At least one person was killed, hundreds of others injured. The unrest marks a major escalation in frustration over the pandemic that is worsening at an unprecedented economic and financial time in Lebanon. A surge in cases has triggered a month-long nationwide lockdown and a round-the-clock curfew. Pakistan's Supreme Court has ruled 4 men convicted of kidnapping and murdering American journalist Daniel Pearl should be freed. The White House calls it an affront to terrorism victims everywhere. Ahmed Omar Saeed Sheikh, a British national, was considered the ringleader in the 2002 kidnapping and killing of Pearl. Pearl was the Wall Street Journal's South Asia bureau chief. Assailants later filmed Pearl's beheading and sent the video to U.S. officials. In December, a court ordered all 4 men be set free. Both the Pearl family and Pakistani authorities appealed that decision, and today the Supreme Court ruled against them. The White House is demanding Pakistan review its legal options, including allowing the United States to prosecute Sheikh. A team from the World Health Organization has emerged from quarantine now in Wuhan, China, to begin work on tracing the origins of COVID-19. They left their hotel to prepare for field work and their first face-to-face meeting with Chinese scientists. The researchers plan to visit hospitals, labs, and markets and hope to speak with patients and first responders. The fact-finding mission is politically charged, though China has avoided any blame for alleged missteps in its early response to the outbreak. The team is expected to stay in China for 2 more weeks. The woes of Wall Street next, the stock market setup, and the chat room where it happened. You may have heard a lot of talk about GameStop. It's a David and Goliath battle between Wall Street's financial elite and some small investors. People have banded together online to drive up the stock price of GameStop, a money-losing chain of video game stores. That company's stock was trading for less than $20 a share, and then recently it began to soar as investors snapped it up. On Wednesday, it closed at almost $350 a share. Jackson Prosco explains how and why this all happened.
This was the week Wall Street got a run for its money.
Social media average Joes versus big money players. And guess what? The army of average Joes are winning so far.
Those average Joes have been on a buying spree, snapping up shares of troubled companies. BlackBerry, AMC Theaters, American Airlines, and the big one, GameStop, the struggling video game retailer.
I'm a blue-collar investor, right? So I scrap all the time, but now when you get something like this, it's one of those all-in type things.
For days, the little guys have been cashing in, all while hedge funds lose billions.
It's just a way of attacking wealthy people
And, I think it's inappropriate. We all got to work together and pull together.
You see, unlike average investors, big hedge funds can actually profit from a struggling business. It's called shorting. If a stock price drops, they make money. But if the price rises, they stand to lose. That's where Reddit's Wall Street Bets message board enters the story. When users saw hedge funds had bet against GameStop and others, they banded together to buy shares, raising the price and reaping the rewards.
There is something to be said about the fact that pretty much anybody can do it too, and watching them do it collectively is certainly a show.
Ironically, this modern-day Robinhood tale also involves a stock trading app called Robinhood, which small investors use to snap up all that shorted stock. But the hero turned villain as Robinhood and other brokerage sites suddenly banned users from trading the most volatile shares, shutting out anyone who wanted to cash in.
Amateur investors are really necessary for the health of the market. So you want them in the market, but you don't want them triggering irrational results.
Risky as their investments may have been, those amateur investors turned the financial world upside down by finding a way to beat Wall Street at its own game. Jackson Prosco, Global News, Washington.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is Ottawa's Rideau Canal. It has opened for the first skate. Only locals allowed, though, keeping in line with Ontario's pandemic restrictions. Skaters have to wear face masks, and for now, only a third of the canal is open. Other sections will open once ice conditions are deemed safe. In a normal year, about 1,700 visitors take a trip on the beautiful canal every day. Thanks for watching. Robin Gill will be here tomorrow. I'll see you on Saturday for the new reality. Take care of yourselves. Bye-bye.